Hey, welcome to the Hopevillage podcast. I'm Ricardo Handy.
And I'm Lucy Hall, coming to you today from the Hopevillage podcast. I'm excited to be with you so that we can talk out loud about recovery, living it out loud, one hope dealer to another.
Let's get into it. My name is Ricardo Handy. I'm a filmmaker. I was recently inspired to make a movie about the life of Lucy Hall.
I always tell the women my story. I used to smoke crack in the bathroom. Today, if you go to my house, what's in the bathroom is my Bible. Because I had to put something in that place that was greater than what used to be in that place.
Her story has inspired thousands of women to get on the path to recovery and change their lives forever.
Like I always tell the women in recovery, now you're the disciple that got to go share it.
Amen.
You're the person who's got to go tell your story. You've got to be an advocate.
In this podcast, we will go in depth with Lucy and the recovery community at large.
You shouldn't have to get arrested to get well. If the community and the place where you grew up and the place where your family lives isn't going to be about redemption, who is?
You are tuned in to the Hopevillage podcast. Stay tuned to find out how you can see the movie Hopevillage and get Lucy's book, The Complete Guide from Rehab to Recovery.
If I can put a Hope Village in every town, we'd be in business.
Hey, welcome to the podcast. We're excited. We got so many cool things planned for you today. Lucy, we had an exciting interview earlier with Neil,
we
right?
interviewed Neil from the Georgia Council on Substance Abuse. She gave us some great information about what's going on in Georgia and what's going on nationally. And you're going to get great information from her about how you can get involved locally here in Georgia. Recovery Day at the Capitol is January 28th, as well as what's going on national with the opiate epidemic. We're excited about that. And then I want to share a little bit with you on the Hope Dealer book. And what's important about this is how we talk to the clinician, how we talk to the addict, how we talk to the ally, whoever you are in the life of someone that you know and love who needs recovery. We talk about it here in the Hope Dealer. And we want you to use this timeless instrument to help you, whether you're the parent, whether you're the addict, whether you're somebody working with people on recovery, or you just want to get involved and help us to live recovery out loud. We got you covered here in Hope Dealer.
Yeah, so you can actually go get the book now over at hopevillageproject.com. It'll be available soon on all platforms, but exclusively available now on our website for pre-orders, specifically because we're packaging it on our website for a special time period now with the book, where you get the book and the movie together. So we're really excited about that because the whole idea is that you use this book and movie as a tool. And the movie releases wide May 12th this year. But prior to that, we actually have gotten to several film festivals, and we will be announcing the dates and times where you can go to the theaters in your local area and see the movie, whether it's through a film festival or through the screening tour we plan to do later in the year. But right now, I want to just kind of, before we jump into the interview, just give you some announcements on where you can go see the film and potentially meet me and Lucy there and talk about this whole movement and this whole project. Upcoming in San Diego, Friday the 31st at 4 p.m. we'll be playing in San Diego at the Black Film Festival there at the Theater Box Theater on at 701 Fifth Avenue in San Diego. And again, we'll be reposting this stuff on our website as well and on our Instagram at Hope Village Project. So please come out if you're in the Southern California area to that one. And there's an additional one happening February 12th in Los Angeles at the Let Live Theater on Formosa, 916 North Formosa Avenue in Los Angeles. So, those are two opportunities to come see the movie, come meet me and Lucy, and see how we can, advocate for recovery together. But again, you can also go to the website and check out the book and buy the book and the film from there as well. But I did have one more announcement, and I actually emailed this to Lucy. I don't think she saw this yet because I just emailed it to her. But we actually also got selected for our first Georgia film festival that'll be happening. Yeah, it's happening at the Broad Street Film Festival there in Georgia, and so we're excited to let everyone know about that as well. We don't have the exact time, but the date is February 21st in Sugar Hill, Georgia. So it's a so there's other festivals are up for in Georgia that are happening later in the year, but we're just getting all the information now for all the February dates. And so as more dates come up, we'll share them on the podcast, we'll share them on the website, we'll share them on our IG. But for now, let's get into this interview we did with Neil and learn how you can get involved in the recovery movement and celebrate recovery with us.
And I just want to add this, Ricardo, if they order the book, if you pre-order a book, the first 1,000 people, I'm personally going to autograph it for you and definitely tell you how you can help me become a hope dealer. Have a great one.
All right, let's get into this interview with Neil. Well, welcome to the show, Neil. Sitting here with Lucy, your good friend. How are you today?
I'm doing well today. What's going right with me today is that the sun is shining. It's been really wet and cold, but the sun's out and it's a good day today.
Yeah, Lucy, you were sharing with me. You guys are celebrating something special this year. What's that?
Yeah, 30 years of recovery in 2020 for both of us, and that's exciting. I didn't think about 2020 30 kind of thing, but yeah, it's 2020 30, buddy, and it's exciting to realize. 30 years, it looks like a blink of an eye, but when you first come into the rooms of recovery, it seems like forever, seems like a long time. And now you look back over the 30 years and it's like, oh, that was quick. So it's interesting that the dynamics of that, because most times people will think when they first plug into recovery, oh, I got to do this every day for the rest of my life. And then they don't realize how quickly life goes by. So it's been a real great journey.
Yeah, and then it turns into I get to do this every day, right? I mean, it's like I get to do it. That's how it was for me. And Lucy, this year for me, I turned 60, so I will have been in recovery half my life.
How cool is that?
Yeah,
wow, you got a lot of things to celebrate this year. 10 years at the council, 30 years of recovery, and 60 years of life. Is that not how God's timing works in our lives?
Yeah.
Wow, that's
awesome.
Real exciting.
Yeah, that's awesome.
I'm going to be partying with you all year long then.
All year, right. I keep saying I'm 60, and people are telling me, well, it's not till July, but it still feels like right now, right?
Absolutely, yeah.
Half my life.
It is all right now. Life is right now. How we live it, you know that. We live it a day at a time, but we live it out loud. So all of it is relevant today.
Yeah.
That's exciting.
I love it. I love to hear you guys talk about your recovery journeys, and one of the moments we were able to capture in the film is you guys talking. So before we jump into the interview, I just want to play this quick clip, and then we'll get back to some more talk on 30 years of recovery.
I mean, you and I will always talk about living it out loud, and I thank God we're not anonymous people anymore. We got to make sure recovery is lived out loud. But I want you to tell me a little bit about your thoughts in terms of what's the solution today.
Oh, goodness. I think a huge part of it is giving voice to recovery. I think we've been anonymous too long. There's 23, 24 million people in this country that are in recovery, and we don't ever hear that. All we see is the problem. So I think, one of the things that we try to do are changing the social norms around addiction. So when people think of addiction, they don't think of someone living under a bridge. They think of us.
You and I got 30 years in recovery.
30 years. We do.
I want to tell the world from the rooftop.
60 years in recovery, right? Because they knew us when we were out there. Why shouldn't they know us in recovery? We want to hide that up.
Yeah. So we've got to let other people know, especially these 16, because I started using in my teens.
Yeah, me too.
Because nobody ever told me anything about it.
Yeah, and we go into high schools and we have conversations with them, and the only commitment we ask from them is that they talk to us honestly about it, about their use and why they're using. And so we hear things like my depression or my anxiety or I can't go in a social situation without taking a little bump because I'm so insecure. I mean, kids are using for a reason. And like you said, they start younger. The availability, if we look at how available opiates are these days, Washington Post has an article where you can actually see where the pills have been distributed in the country, 76 billion in a 6-year period. Yeah. And we sit around here and wonder why we're not seeing more of a sense of urgency in this state. Between 3 and 4 people a day are dying of opiate overdose. Why aren't, if it was any other illness, If it was Ebola,
Right.
if it was, West Nile, if we had 3 to 4 people dying a day, everybody would be laser focused on it. But because it's us, because it's people who are using substances and may have a mental illness, we don't talk about it as much. Sometimes I just want to grab some policymakers by the lapel and say, what are you doing? We know we can do this. We can fight this. We just got to fight it harder.
Wow, that's a powerful part of the movie where one of the things that stuck with me when you say that when you talk, Neil, is about, if there was 3 or 4 people dying a day from any other thing, the reaction that it would be. And I know that a lot of things have changed over the past 30 years on that topic, but not enough, right? So can you guys just both share, Neil, especially about just what has changed over the last 30 years in the conversation around recovery and addiction?
Yeah, well, first of all, I think that's a great question. There's people like Lucy and myself who are talking about this stuff out loud. We're not just in church basements talking about our recovery. We're everywhere. So I think that's a huge difference. The other thing is, this stuff was happening 30 years ago, that communities were being devastated by opiate overdoses and addiction. It just was in communities of color primarily, and you didn't hear about it as much. But now that a lot of the folks who are dying are people in the suburbs, there are white people there, it's manifested itself in communities that have a lot of visibility. And so I think that's a huge difference that we don't talk enough about. That what if, I've got a very, very diverse staff, and some of them are really angry. Why now are we seeing all this attention? That it's okay now to talk about our recovery. It's okay to put resources. The government just put $1 billion into opiate addiction to help solve the problem, and they should. But we should have done it 30 years ago. And Lucy, you can speak to how crack devastated communities of color as well. So I think it's a different drug, different community, but it's the same problem and a lot of the same problems.
And I would add to that, I think, as opposed to get angry, buddy, and I would say this to people of color, as opposed to get angry, let's look at the opportunity.
Sure.
And the opportunity is the prevention side of it. If we can take that $1 billion and prevent the children of this next generation, the millennials and Gen X or whatever generations, if we can end this vicious cycle, then, it would be helpful. But I think to your point, you're absolutely right. Had we done it 30 years ago, we would have saved a lot of chairs in the basement or in the room.
Right.
But
right.
Today, I instead of getting angry over what they didn't do then, I can look forward to what I can help them do now. And I guess that's where I got to keep my mindset, because you and I both know we can get angry about a lot of things. But the thing that people got to realize is, let's just share the hope now. And it is different now. There are those people who are armed to talk out loud. We talk about everything today, whether it's HIV, whether it's mental health, and we need to, because these are the things that are preventable and curable, and we can do something about it. And it's to your point, we can say the same thing about HIV. Well, it's killing mostly Black women, so we don't give a whole lot of money to it. Sad but true. Right. But I still have a responsibility as a Black woman to share with another Black woman.
Right. So Neil, we really want to hear from you. Not only your personal recovery journey, but just how you got into this work with the Georgia Substance Abuse Council, and then we want to hear after that, how that works and how we can participate. But take me back to the beginning. How did this whole journey of recovery start for you?
Yeah. So I was in my late 20s, and I had been drinking alcoholically for years, for probably 20 years, and I was getting physically sick, because one of the things we know too today we don't talk enough about is that we have about 88,000 people a year dying from the effects of alcohol use. And so I was going to be one of those statistics. I think eventually I was really sick. My life just sort of fell apart, and I luckily had a community around me that said, hey, we want to help. We believe in you, and how can we help you get better? And a friend took me to a 12-step meeting on July 30th, 1990, and I never picked up another drink. So I was lucky. I got it the first time, and have been sober ever since. And I came to the council. So I have a background in criminal justice. My bachelor's degree is in criminal justice. My master's degree is in criminology. So I worked in the criminal justice field for 25 years. And then I had a career mentor who became the director of behavioral health, and she hired me as the first director of the Office of Addictive Diseases here in Georgia. So we never had, prior to that, addiction services was underneath mental health services. So this was the first time that we actually had an Office of Addictive Diseases, and I was the first director. That was in 2005, and that's where I met Lucy. That's where she and I came across each other. She was one of the providers in our system, and I got to know her then. So Lucy, we've known each other 15 years now. So.
Yeah, buddy, I was thinking about that.
Do the math. And so I did that for 3 years, and I made the decision then when I looked at how the system was operating. It was not, it felt really, there was a dissonance between what they were saying people like me needed and what I knew I needed when I was getting well. And so I only stayed there 3 years, a little under 3 years, left for the first time in my life, left a job without a job, and just, got real about it and said, I want to become an advocate. And I hooked up with a group of folks. One is a woman she was in DC at the time. She was running Faces and Voices of Recovery. Her name's Pat Taylor. And she told me about this group in South Carolina and this group across the country of people in recovery that were trying to do a sort of a person first, self-directed movement, grassroots movement. And just by chance, about 6 months later, the board chair of the Georgia Council on Substance Abuse called me and said, hey, I hear you know a lot about what's going on in Georgia. Do you think we need an advocacy organization still, or should we close this thing up? Because it looked like the council was not going to make it another year. And so we had lunch, and the executive committee took me to lunch, and they hired me by the end of it. And it was really funny. I always tell the story. They said, well, how long do you need to turn an agency like this around? And I said, well, I think I need about 2 years, 2.5 years. And they said, well, you got about a little less than 18 months. And at that time, the council was just me. And it did. I just did what I did in early recovery. I said, I'm going to hang with the winners. So I called Lucy and others, and I'm going to just do first things first, one at a time. And I just started volunteering, and I started to have people get to know me on an advocate level as opposed to a state director level. And, it did take about 2 years and before we even got our first contract with the state. And that contract was to train people in recovery to be recovery coaches. And we call that CARES. It's a Certified Addiction Recovery Empowerment Specialist. And that was we got the first funding in 2010. We did the first class at the beginning of 2011. And now we're on our 38th class, and we have over 740 people that are certified as recovery coaches in Georgia. It's a Medicaid billable service, and I have 35 full-time staff today. And from 12 years ago,
that's awesome.
It's just me to
That's
30.
Awesome.
That is not a testament to my business acumen. You can ask my board about that. It is more a testament to the power of recovery and the contagion of recovery. I always talk about a recovery epidemic as opposed to an opiate epidemic. We need a recovery epidemic.
You better believe it.
That's what we're seeing now. So that's kind of my story in a nutshell. And, I love my team. It's 35 people in recovery. I do my best to hire people who are coming out of incarceration, and most of my staff are, and, or at least have had incarceration in their background. And there's a huge barrier in our system of hiring people who have felonies. And, I've hired fugitives before, and it's like, but you have to go through this approval process. And it's just, we make it so difficult for people coming out of prison and jails that it's ridiculous. So I'm just really proud of my team. We want to see this movement grow. We see it growing. So I can't say enough about the opportunities that I've had and the supportive board that I've had and the supportive community, people like Lucy she'll call me up. We didn't have a place we were getting very little money for that first class, if you remember, Lucy. And I said, hey, can we have it at your center? And we had the first couple of years at your place because I didn't have any money, and it was awesome. So we are of the recovery community. I don't think there's probably not 100 or 50 square miles in Georgia that doesn't have a recovery coach somewhere, because we're everywhere and very much on the grassroots level.
Yeah, I'm just listening to you kind of share your story. And some of the details there I wasn't aware of, but it sounds like in the beginning there was a lot of trust building that happened between the advocates, between the advocate and the actual folks on the ground, the clinicians and helping the folks in recovery. So Lucy, I just want to have you share a little bit about what was it about Neil and her approach that really made it work for you.
Neil and I have a lot in common. We keep it real and we keep it moving. She knows those are my two sayings, that keep it real and keep it moving, because it's so important that we do that, especially with people in recovery. Like you were just saying, when you build trust with people want to see you be transparent and be real, and it's easy to do that when it's who you are and you're just living it out loud versus who you need to be for this group or who you need to be for that group. And I think Neil is consistent with who she is, true to who she is, just like I am to me. And I think that's what everybody wants. They look for the authenticity of people, and that's what gets us to where we are. I think, when people are first coming in, we have major trust issues in recovery when we first come in. One, because we know we're the biggest liars when we were out there. So to turn that around to telling the truth, I can think of my first truth test was early in recovery when I was still living in a halfway house, and my sponsor, I had stole something because I was doing what I knew how to do. And my sponsor said, well, Lucy, if you really feel bad about it, take it back. And I was like, what? And she said, if you really feel bad about it, take it back. Well, guess what? I did. And that was the last thing I've ever stole, because taking it back was harder than stealing it. And that's the same principle I built my recovery on. And that's how I test people. The word of God tells me test the spirit. Well, you'll test a man. You listen to them long enough, you'll hear what's in their heart. And that's what you go with. You go with what people say, because you let them talk enough and they'll tell you exactly what they're about. So my buddy's always been consistent and real. Even when we don't agree on something, it's okay. It don't make or break who you are. It's just that you don't agree on that same thing. Okay, it don't make a difference. We still need to know that at the root and the heart of it all, it's about helping people get well, helping people have access to care, helping people know that this thing called recovery works. And so that's what I love about my dear friend.
That's awesome.
And Lucy has helped. I just would like to say that Lucy, you too. I mean, it's like, we all know it's about the 8th and 9th step, right? It's about relationships and owning our part in relationships. And Lucy is person enough she's got a huge heart. And if we don't always get along. And I'll also say we don't always get along. Carlo, you said, what was it between the treatment and recovery, the clinicians and the recovery coaches? We still haven't ironed that out. There's still a lot of, not everybody thinks that someone in recovery has anything valuable to say. And we have clinicians out there today. I had an experience on Friday, someone saying that we're stepping out of our lane and we really don't know what's going on. We don't have enough, our training isn't good enough. And, we get that kind of stuff all the time. But we, as Lucy said, we try to be our authentic selves and let the results speak for themselves. We currently are working on a program in 3 emergency rooms in rural Georgia. And we have people coming in that say, I've never had anybody ask how I'm doing or ask what I want to do. And that's what the coaches do. We just walk alongside someone. We are not therapists. We're not counselors. We just want to, be with that person, because we know this recovery is a we thing. You don't do it alone. You can sit in a room and not use, right? But you got to go out into the world and live. And that takes, some coaching, that takes somebody being with you that just cares about your recovery. So I don't think we're there yet in terms of getting our 2 worlds together, the treatment and recovery folks, but I think it's getting a lot closer. I hope.
I would agree. And I would even say to that, Neil, because when you first started talking about it, my thought most often, because from the seat that I sit in, I hire both.
Yes. Yeah.
As a treatment provider, I hire cares, people in recovery, and I hire licensed clinicians who are not in recovery. And to your point, we do need both. But I think, if I was to group every LCSW as the same, or every, LPC as the same, I can't group every cares as the same. Each individual brings their authentic self. And I think, an experience with one person can't deem the whole group. And I think that's where some of that gets hung up at, is that if I, you know, and I know, I mean, I've hired cares and it didn't work out. Well, I've hired clinicians and had to fire them. Both is, you know, and so, but then I have those who were in the first round of cares that is still with me from cares 1 and 2. And now we're up to 38. And so, you know, it's both and it's neither, it's never you people. And that's where, you know, this time last year, that's where my struggle always comes in, when we group everybody based on one experience.
Right.
That's not fair.
Right.
That's not fair to any group of people when you base your opinion of that whole group on one experience. And I think we do that from the place that we come as humans. We got to get out of that. So to your point, recovery is coming to an intersection where we as providers and people in long-term recovery are going to make such a big difference. I mean, when you think about, like you said, in your 10 years with the council, think about where you've come. Like you said, you were a long ranger and now you got 30-something staff. That's powerful. That's powerful. And
I miss the good old days.
Yes.
Yeah. So it sounds like what you guys are sharing kind of leads into our next topic, which is pretty much that, you know, we need the entire community involved, right, to get to make a change and make a difference. And we're all going to come from different perspectives. We're going to come from, you know, the perspective of a clinician or a recovery coach, someone that's in recovery. But then there's also the family members like myself, you know, where we have a loved one that we just want to help, right? And we all need, you know, this information, and we need to know what's going on to make sure that we have the proper resources. And so I just want to kind of lead into, you know, what you're up to now, Neil, and what kind of policies you know, you guys are really pushing for. I know you guys have a big event coming up on the 28th that I want to share about, and how people can get involved. But before we talk about that, I just want to kind of get a global kind of idea of, you know, what policies have over the last 30 years helped, and maybe what have been roadblocks to kind of bridging these gaps.
Yeah, so let me say what we're up to these days is a lot of community building, of getting things back to the future, like back where how it used to be. We're building recovery community centers all over the state, and those are peer-run facilities or peer-run programs that are available. You don't have to have a diagnosis to walk in, right, and to get services. You can walk in and just get loved on. You can walk in and just get job training. You can walk in and just get a GED. You know, the things that really, we always say that what helps us, people in recovery, is something meaningful to do during the day, a safe and sober place to live, and a date on Friday night. And you can get all of those things at a recovery center. So well, maybe not the safe and sober place to live. You can certainly be around safe and sober people that can help you find a place to live. And so that's what we're about these days, is building communities of recovery. And that's been my life's work in the heart. I love this work. I love what we're doing right now. And I think it is sort of how it was 30 years ago. It's getting more driven by people in recovery, instead of experts in our lives telling us what we should be doing. And there's a huge difference there. So I think a lot of building community, a lot of, we're speaking out. We do recovery messaging training all over the state, really all over the country. I get to go to Kodiak, Alaska next month and talk about how do we build a culture of recovery, because I think that's one of the huge things and important things that we do. So the messaging is person first. I'm a person in recovery. I'm a person with a substance use disorder. I'm a person who has struggled in the past. You know, I'm not an addict. I'm not a junkie. I'm not an alcoholic. I'm a person first. So I think that's got to be where our language gets to. So people look at us as not just being those people. And we have a lot of that stigmatizing going on.
Quick question about the recovery centers. You know, because we've been talking about this a lot, and I've been hearing about it. But what are, like, if you're in Georgia and also if you're in another state, how do you find one of these recovery community centers?
Yeah, so in our state, you can call our warm line number, and we can give that out here, 844-326-5400. But we can, I'm certainly, Ricardo, you can put that out there, and they'll tell you your local where there are. There's in Georgia. So I think you have to, in other states, I'm not quite sure.
Got it.
But
Got it.
Yeah, they're out there, and it's an amazing thing.
She's working on creating a national directory so that we can answer that question a year from now. Bet you by golly.
Okay.
Yeah, well, I mean,
actually, you can go to the Association of Recovery Community Organizations website and see theirs. You know, you click on your state and see where they are. I think not everybody is an ARCO member, so there's other community centers in Georgia that aren't ARCO members yet that are on that website. But yeah, so we're findable. And I think, that's what we're about. And I think that, anti-stigma, making sure that people are using recovery positive language, that's where we are. We have a huge event at the state capitol on Tuesday. We used to be on Thursday. It's Tuesday, January 28th, beginning at 10 o'clock at the Freight Depot right across from our state capitol. We're going to have a rally at 10 inside the capitol. And that's going to be, we actually got confirmation last Thursday night that the governor is coming. So he's going to kick it off at 10 o'clock, which is exciting. I mean, because he's doing a lot of budget cuts this year. And so I want to have 1,000 people is our goal, have 1,000 people in that room to say that are in recovery or that love people in recovery or are professional helpers and say, we don't need to cut this because recovery is real and it's happening all over Georgia. So
that's working.
And it's working, and you can touch it and feel it and hug it, and it's real, and it's going to be really, really, really exciting.
No, that's awesome.
I think we're going to have a huge, and that's grown from, 10 years ago it was 200 people, and now it's going to be 1,000. So that's a lot when you think about talking about recovery. We're not there just saying don't cut us, don't cut our funding. We're saying when you promote recovery, I pay taxes, I buy my own home, I raise a healthy family. All the things that I think everybody across party wants for our people in our state.
So let's give that information out again. When if you're in Georgia and you want to participate in this event, Neil, tell them again what can they do? When should they be there? What should they bring, if anything?
Yeah, bring themselves. Bring ready to advocate. We'll do a recovery messaging training and give you some talking points, and then send you over to meet your legislators. There's going to be a proclamation read in both the House and the Senate at 10:30 that morning. Then you come over to the Freight Depot. We will serve you lunch, a box lunch. And I say get there early because we have, I think, 700 meals, Lucy, and probably 1,000 people. So it's going to be a crowded, fun day. And it's the quickest day on earth. You can go to our Facebook page or our website, gasubstanceabuse.org, or you can just Google us and you'll find it. Addiction Recovery Awareness Day.
Addiction Recovery Awareness Day in Georgia. Georgia Substance Abuse Council website. Go get all the information you need, and we'll share the flyer as well on our social media. Hopevillage Project at Hopevillage Project on IG. So yeah, that's exciting. What about for folks that are outside of the state? Are unable to come. What is it that they can do to advocate locally in their local city or their local state in the same way you guys are doing here in Georgia?
I think that what you do is you educate yourself on where your state is and what they are, where the funders are, where the levers are. That's always, an interesting exercise, is to find out where the money is going. And if you're doing if you feel like it's going to the right thing. There are states that they're doing some amazing things, especially states who expanded Medicaid. They're able to get people into treatment a lot quicker. There was just a study released that said that. So I think educating yourself on where your state is. There's also a House Bill 2644, I think it is. I will check that. That is to extend the opiate funding that has come down from the federal government. And there's a bill that has been dropped in the United States Congress, and we're promoting that you can find that all over our website as well, because that ensures that the money that your state got from the federal government the last 3 years will continue through 2024. So we think that's really important. So there's some big funding things like that. Don't be afraid to call your legislators. Don't be afraid to call your policymakers and say, hey, I'm in recovery and I want to help. Because when we switched our message to that, as opposed to saying, hey, give us more money for alcoholics and addicts, we stopped saying that about 10 years ago, and we started saying we're in recovery and we can help, and we want to help, and we want to get to know you. We want to be welcome back in our communities, and that's, I think, been the difference for us.
That's awesome. That's a great point and a great message to share. You know, like we want to help. We want to help each other. We want to help our communities, and not we need.
And the truth is, Ricardo, we are helping. I mean, it's not even before the council, before there was a CARES. Lucy knows this. There are people who are sitting knee to knee today without any government funding, without any outside influence to help each other. There is one person seeking recovery and one person in recovery, and they're helping each other. The recovery community has a long tradition of helping, a long tradition of giving back. So we're just highlighting what we do, and we want to see more of that, right? You always want to see more of what's working. And what's working is us sitting together, helping each other, listening, just being that ear, being that someone, you know, as I always say, in my early recovery, they loved me until I could love myself. Mm-hmm. And I have to give that back. In order to stay well, I have to keep doing that. So I think there's, you know, it's just a long tradition of people in recovery who do good things, and we're just highlighting that.
That's awesome.
And I think one of the things, Ricardo, I think about as I'm listening to Neil, and I think about where we are in the sustainability of it, as well as the future of the movement and it continuing to grow and have great impact, is really helping, just like she said, to educate communities. I think that's really important. And I'm just, you know, sitting here thinking about a message I listened to this morning with Pastor Dennis over at Victory. He's very much involved. He's very much wanting his church to get involved in something Neil's hit on earlier. And that is helping people coming out of incarceration get employment. Because, you know, like I know, the only way that people are going to survive is to work and to be able to, you know, feed and clothe and live in their communities. And so how do we begin to educate people that people need a second chance? How do we get people to realize? And I think that's part of the sustainability of the recovery community organizations, is really doing the education part and really throwing people into what their work is. And I think you just hit the nail on the head, Neil, when you said them being able to go and say, hey, we want to help and we want, you know, to partner with you, with people who come into your congregation, or with people who come into your office, or with people who are in your communities who need to know that we're here. And so I would love to kind of talk more about that with you, buddy, you know, post this, because I think that's the sustainability part of the recovery community organizations. And I know that some of the recovery community organizations are doing an awesome job at that. I think about Claudia every time I go visit her up at the shop she has. You know, there's more partners, there's more involvement, and that's exactly what each of them need to know, is how to go about engaging the community. Because people today, especially with millennials, people want to know what they can do. How can I get involved? How can I make a difference? Because at the end of the day, if I don't tell you how I get involved, we just tell you a great story. So I think you just hit it on the head when you said, hey, if you want to get involved and become more knowledgeable, whether you're a family member, connect with a recovery community organization in your community. If you're an ally, you know, a friend, or know somebody, or if you're an employer, you're looking for people to work for you, there is a group of people who want to help, who want to do the right thing. So I think there are so many ways in which you can get involved, and I think that's important to highlight.
Yeah. Neil's dog just paid a visit to her, which is all good. I think that's a perfect note to kind of wrap things up on. Here's the underlying message is, now that we're with this podcast, we're putting out, as much information as we can gather, as pointing you to as much different places as we can for you to get involved, with Neil, and what the Georgia Public Council on Substance Abuse Council is doing in Georgia is awesome. And we want to try to, support them and share with you every way that you can get involved. But then also, if you're in a different state, in a different area, that may not have a Neil, doing her thing, then it might be time to, not only reach out to say, hey, how can I duplicate that in my area, but also reach out to your legislator and let them know, hey, this is what we need in our area. How can we make that happen?
Absolutely. It takes one hope dealer like her to get it going. So let's get it going. If it ain't there, it don't mean it can't be. Like we said, keep it real and keep it moving.
Exactly. That's how we'll build the village. One city, one state at a time. And that's what we hope to do is help heal, as many areas as we can, in this thing we call being human, So with that, Lucy, I'll give you the last words of wisdom, and then we'll let Neil get back to important work that she's doing, and let everybody get back to their day.
Hey, buddy, I appreciate you. I love you to life, and I'm excited about celebrating recovery out loud at the Capitol on January 28th, Tuesday. And it starts, like she said, come early so you can learn how to do recovery messaging down at the freight depot here in Georgia. And we're excited about it growing and just being advocates, just being people who are in long-term recovery, just being people who care that people live well and live the life that God intended them to live. I'm excited about it. Again, 10 years of the council, 30 years of recovery, and 60 years of life. You go, girl, and you look like 30 years old over. I love you to life.
All right.
Love you, Lucy. Thanks for Carla. Appreciate you guys.
Thank you. All right.
Thank you. Absolutely.
Great. Well, that's it for today's episode of Hope Village Podcast. Please keep tapped in with us on our Hope Village at Hopevillage Project IG, and please go to hopevillageproject.com to get the book and the movie available today for pre-order, and we hope to see you on the next episode.